The role of National Clinical Lead has both national and local aspects to it. I find myself quite often working with clinicians, trying to innovate practice, and that requires both clinical expertise but also academic expertise. We often have to take evidence from the literature and kind of somehow translate that back into practice so we can have a really sound innovation that's based on evidence-based practice. But equally, nationally, I find myself having to, again, represent the NHS improvement in terms of our national profile and presenting where we're moving in terms of that agenda. The national priority projects for cardiac rehab have been running for 1 year just now. We feel it's been a very successful year. We've had priority projects involving heart failure, return to work, commissioning, innovation in practice, trying to look at cost effectiveness in this kind of modern climate. We've brought clinicians together from all over the country. They've been very willing to share their practices. We feel it's been a very useful experience for all involved, not just the team, but also for all the clinicians involved in that particular process. We've developed a very, very useful website as a consequence, which we find very useful for clinicians, and we hope to move forward in over the next year to involve even more projects. The biggest challenges facing cardiac rehab moving forward, as been shown recently by the National Audit for Cardiac Rehabilitation, remains uptake. Uptake is exceptionally low. It's as low as, on average, 38% across all three conditions. This is quite unacceptable in the present climate, and we need to do much, much more to change that. It's made difficult in many respects because of a further challenge, which is the tariff, the ability to price effectively and to gain funding for cardiac rehabilitation. What's also become clear along this process is that referral to cardiac rehab is a real challenge. We need to work more and more with our clinical colleagues to make sure we have referral through to rehabilitation so patients can be assessed and rehabilitation can be offered in an appropriate means. For me, the involvement of patient and carers in rehabilitation is vital. It has a local element to it, primarily for me, where I work as a clinician, and we work with patients and their carers to make sure we set realistic, achievable goals so they can have the best outcome from cardiac rehabilitation. But equally locally, as part of the national priority projects and also the national improvement work, we work with patient support groups and cardiac support groups to make sure we kind of push that we have equity and equality across the country.